Good morning, welcome back. My name is Dr. Khadija Beneka. I'm a senior resident in obstetrics and gynecology. Today I want us to discuss infertility, but just to break the cycle that it's always the woman's fault, I want to start with male infertility. I think it's always been generalized that a woman is almost always a cause of infertility in the African setting, and this is wrong. So that's why I chose to start my discussion on infertility with male infertility, and it's important for people to know that male infertility contributes to, infertility is like 15-20% of couples are struggling to conceive, and out of this 25% or 25 actually to 30% is caused by the male factor, and 20% is caused by male and female combined. So you can see men contribute like half of the infertility etiology or causes. So before I get into the causes of male infertility, it's important for us to, disclaimer, there's going to be a 3-part series, and it's important for men to understand their organs. I think we have always empowered the girl child. We've always empowered the woman to know their sex organs, their female reproductive organs, but do men know their organs? In my practice, I see a lot of men who come with prostate issues, and I tell them about the prostate issues and they get surprised. They ask me, what is prostate? And that is like a 60-year-old, 70-year-old man who doesn't know what a prostate is. So it's important for men to understand their organs. It's important for men to also sometimes, feel and get the texture and see if there's any problem anywhere. So I'll start with the organs that are most known by all. So I'll start with the penis. You can see the image next. That is what a penis looks like. And so what is a penis? So a penis is basically a circular structure that is composed of 3 circular chambers that are sponge-like, that have tissue that is sponge-like and that fill with blood during arousal. So this filling with blood is what causes the penis to, to be very hard and erect. So that is what a penis is. So it's just 3 chambers of tissues that are sponge-like that fills with blood vessels with blood during arousal and erects and becomes hard, right? So the skin of the penis is very loose to allow for this elongation that occurs during erection, elongation and increase in size. So what is the function of the penis? The penis is for urinating, and the penis is also for expulsion of sperm, what we call ejaculation, right? And the next structure I want to talk about is scrotum, that bag that hangs outside. See the next picture? Yes. So I like calling scrotum the climate control or the temperature control system of the male reproductive organ. So for normal sperm production, the temperature should be ideally less than the usual body temperature. That's why testicles are inside the scrotum, outside the body. So the scrotum is this bag of skin, and it has its own muscles that contract and relax depending on the temperature. So if it's very cold, the testes will tend to be pushed up towards the body. If it's hot, they'll hang out freely. So testicles are scrotum, that bag that holds the testicles. Then we have testicles, those eggs inside the scrotum. There are 2, one right, one left. And what is the function? They make sperm. That is, they're involved in what we call spermatogenesis. So they have a system of tubes inside called seminiferous tubules that produce sperm. So as a man, it's your responsibility to occasionally feel them. Feel if they're both there. Feel if they're smooth and good texture, right? Because you could be having testicular cancer without knowing. You could be having testicular masses without knowing. You could be having testicular tuberculosis without knowing. So it's important to also check if both of them are there, because it's not uncommon sometimes. It can occur that you can get a man with 1 testicle, or you can have a man who has 1 undescended testicle. Like during birth, they didn't descend, it's still in there, near the abdomen, what you call the inguinal region. So it's important to feel and know that you have them. Number 3, I'm going to talk about epididymis. See the next structure in the picture? Yes, that one, epididymis. So it rests above the testicles at the back. So what is the function? it stores and transports sperm. Okay, so once sperm is formed in the testes, it's usually immature. So the maturation and the storage happens in the epididymis. It looks like fish above the testicles, above and backwards, yeah? So it stores and helps in maturation. During sexual arousal, it also contracts and forces sperm into the vas deferens, which we're going to discuss next. So what is a vas deferens? If you're seated right there, try and feel them. It's important for you to feel that you have both vas deferens. They're like coils of sliding wires, yeah? Coming from the body, coming from the testicles actually, towards the body. Feel them. You'll feel like strings, yeah? Like hard structures that slide, yeah? If you feel them like this from the testicles going up, can you be able to palpate them? Yes, those are vas deferens. It's important to know because there are men who have like what this is called cystic fibrosis. They can have absence of this vas deferens. So these are the tubes that transport sperm from the testicles all the way to the epididymis. Okay, then from the epididymis all the way to the urethra. Okay, so it goes up, then epididymis, and comes down. Then there it forms other structures which I'm going to discuss. So as a man, feel, because if you don't have this normal vas deferens, you'll not be able to transport the sperm that you have formed in the testicles. They remain down there, and we need them out for them to make a woman pregnant. Okay. Then number 3, I'm going to talk about ejaculatory ducts. So ejaculatory ducts are formed by fusion of small ducts that are coming from the seminal vesicles, and I'll discuss what seminal vesicles are. Okay, and now this vas deferens, this tube that we felt, then these are the ones that now push the sperm into the urethra. Urethra is that tube that is inside the penis. Hope that's clear. Then seminal vesicles. See the next picture? You can see it? Yes. So seminal vesicles, they attach to the vas deferens. We say they have their own little ducts that attach to the vas deferens, and then they form now the ejaculatory ducts, yeah? So seminal vesicles are very, 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 very important in a man. Extremely important, extremely, because they produce a sugar-rich fluid that is rich in a sugar called fructose that helps to give energy to the sperm to do what? To move. Okay? So the secretion from these seminal vesicles forms the majority of the volume of the liquid that forms, semen, what sperms swim in, right? So if you don't have normal function in seminal vesicles, you could also have issues with fertility. You could also have issues with the sperm motility because the sperms need energy to propel, to swim, to move forward. Okay? Then we have the prostate gland. Prostate, right? Prostate gland. And this is one that gives men issues in their 40s, okay, late 40s, 50s, 60s, 70s, okay? So it's a walnut structure. See the picture next. It's usually located below the bladder, okay? Then it also contributes additional fluid to this supporting semen that nourishes the sperm. And the urethra runs between it. You can see in the picture, the urethra runs between so you said sperm is from the testicles, goes up to the epididymis, then the vas deferens goes towards seminal vesicles, forms ejaculatory duct that comes to the urethra, and the urethra now comes down to the penis, yeah? So before the urethra gets to the penis, it passes in between this walnut structure, looks like a larva, called the prostate gland. So these prostate glands will also inject some fluids into the urethra that will mix with all these secretions, all this semen, and so it produces additional fluid that contributes to nourishing of sperms. Then the sperms now get into the urethra, the tube, then out in the penis. Great. Then there's also another gland called the Cooper's gland or the Bulbourethral gland. Okay, so it's just below. See, there's the prostate. It will inject its own things. Then just below there's little peanut-sized glands called the Bulbourethral gland or the Cooper's gland, And these ones, you can see in the picture, they produce slippery. And every man knows that their semen is slippery, yeah? Like mucoid-like almost, yeah? So they produce this clear, slippery fluid that empties directly into the urethra also and contributes to the slippery nature of the semen, all this concoction, yeah? So this, what is the purpose of this fluid, this mucus slippery fluid? To lubricate the urethra and also to neutralize any acidity that is in that pipe that maybe could have been caused by urine, because men use the same pipe for urination. Then once you finish urinating, once you get aroused, it's the same pipe that will also push sperms out, yeah? So if there's any urine that was left in that tube, the slippery secretions from the Bulbourethral Gland will help to clear the acidity or to neutralize, because sperm and semen is more alkaline, okay? So that's it about the anatomy. Hope it was not complicated. It's important for a man to know these things. And, and the things that you can touch, kindly, just feel them. Just look at your penis. Is the opening at the tip? Because if the opening is, can I just get a pen? So if this is a penis, okay? So the opening should be here at the tip. So if you have an opening that is above here or below, suppose this is a male penis, yeah? Like it's coming down like this. So the opening should be at the tip. So if it's above or below, it could cause trouble. Okay? So it's important for you as a man to check. Just if you can't check, just take a mirror and look at it. Yeah? Feel your testicles. Are they both presently there? Do they feel painful? They should not be painful. Are they soft? Are they soft and regular? Or do you feel something hard? Because we always tell women, palpate your breasts, feel for any mass, but we don't tell men to do this, and they should, yeah? Actually, most men with testicular cancers are diagnosed when they come for infertility assessment, yeah? Then feel also your epididymis, that is that fish-like structure that is just uko nyuma, behind the testicles, yeah? Feel it. If it's painful, it could be something could be blocked and storing all the sperm and not expelling them. Could be having an infection. Yeah? Right? And just check your stuff. Just know, And the last but not least, the other most important thing in a man's reproductive organ is the brain. Yeah? So if you have like any funny headaches, or you have been diagnosed with any tumor, it can contribute to issues, because some of the hormones, FSH, LH, they come directly from the brain to stimulate production of sperm and to stimulate the production of testosterone and all these things, okay? And then again, also, as a man, you should also look at yourself. Do you have breasts? Because if you have breasts, it could be an hormone imbalance that needs investigations, yeah? Do you have a normal hair distribution? Do you have like a normal beard, right? Do you have a beard? Do you have, like if you have baldness, do you have normal male pattern of baldness, yeah? Do you have normal distribution of body hair? Do you have hair in your armpits? Do you have, pubic hair? All these things could, if all these things are abnormal, it could indicate abnormalities that could cause infertility. Yeah, what is your height? What is your structure? Right? So that's it. So that's part 1 of the video. Next, we're going to do what you need to be asked if you're coming for infertility. Okay? Thank you.